I feel very honored and privileged to have you at the office, Dr. Sachin Shridharani, the founder and the CEO of Lux Surgery of your office in the United States. You are the most renowned injector of Becara, also known as Kybella in the States. What differentiated you from other injectors?
Well, it's a privilege and honor to be here. Dr. Sophie Liu from Taipei. I mean, you were one of the original individuals that was trained in the U.S. with Becara, with your exposure to Kybella in the U.S. at UCSD, and that was amazing with your fellowship there. So it's really an honor to be here as well, spending time in your amazing clinic as one of the premier dermatologists in Taipei City. I'd say that probably the unique experience that we had with Becara is having gotten the product really when it first got FDA approved. We had the unique opportunity to start treating patients immediately after it was FDA approved. I was actually the first plastic surgeon in New York to have commercially available Kybella or Becara, and immediately we did some unique things with it. We really understood the value of a new injectable into our aesthetic armamentarium to treat patients, get rid of the double chin, and start melting fat, which is a really exciting proposition in the aesthetics world. As a fellow colleague that performs liposuction, we know patients have a lot of options, but if they can have minimal downtime, no surgery, no scars to treat a very specific area like the face, they're going to get really excited about that. So now we've done about 2,000 treatment cycles on patients from all over the world and are seeing amazing results. I'm really excited for you to be one of the first in your country to be treating patients with it.
I know you are very outstanding, that you are not only an innovator and also the founder of many brand names like Lux Surgery, 2+ Talk, or surgery in a syringe. You invented so many brand names for your office and your practice. It's so amazing to see your office and you are growing all over the time. And I attended your talk last year and this year. I can see the innovation you always have all the time.
Well, thank you. I mean, I think so much of what we do in aesthetics is innovation-based. We are probably in the most exciting specialty within medicine. The success of an aesthetics practice is reinventing yourself and finding new ways to treat patients and get them great outcomes. So if your mind isn't working in a creative way, I think you're just falling behind. So I often will think about different concepts of how we can help patients, make sure there's good science behind the aesthetic treatments. And for me, surgery in a syringe, which we trademarked, was kind of a no-brainer, because I said, wow, we're giving patients a surgical outcome, but without having to use a knife or a scalpel. I was like, it's kind of like surgery in a syringe. And it was like, oh, that sounds kind of like a fun, clever way to help communicate to patients and colleagues effectively. So we're always trying to think about unique ways to, again, grow and innovate in the practice.
Amazing, and congratulations.
Thank you.
How do you train your staff in the office to engage and embrace a new treatment like Kybella or Becara in Taiwan?
Yeah, so I think one of the first things that we did in the office was to get our team excited, because the team then gets patients excited, is I treated staff. So anyone who was concerned about their double chin or submental fullness, I said, I want to treat you. Let's see how it goes. We know it's going to work well, but they are the face of the practice, right? They're the first ones to answer the phones. They're the first ones that patients see when they walk in the doors. So if all of a sudden a patient is used to coming into our clinic and sees one of our staff with a much cleaner jawline and neckline, they're like, wow, you look great, you lose weight, or you look different. And the team eventually is like, oh, I got Becara. And like, oh, what's that? So all of a sudden they have a conversation, and it's a very disarming conversation with patients, because they are not accustomed to getting medical advice from them. So it's very conversational. And then when they meet with me, they're getting this very professional discussion and conversation. So they have sort of a fun, engaging conversation with staff, and then a good conversation professionally with me. So across the board, they're hearing this conversation a couple of times in different ways, and it's relatable to the patient. So treating staff, helping them understand the swelling, the amount of cycles needed, is no better way than them experiencing it on their own.
Right. I think especially for an innovative and new treatment, it's essential to see the result and observe the downtime of any treatment.
Yeah, absolutely. Because Belkyra is different than other injectables, as we know. If you get Botox and filler, you can go back to the office a few minutes later. Maybe you have a little swelling or a small little bruise, but it's no big deal, right? Belkyra is a little bit different because you are going to have that social downtime or swelling. But the difference is you're getting a permanent change, a permanent improvement. So what I tell patients is that there's no perfect treatment, and in exchange for avoiding surgery, you're going to have permanently destroyed fat cells, a cleaner, tighter jaw and neckline. All you need to do is give me a few days of social swelling and downtime, and I will give you the rest of the way. So we work together as a team. So I think they understand and respect the honesty of telling them that things are going to look worse before they look better, but let's work together as a team and we're going to get you there.
Right. You are very transparent and honest about any treatment, either injectables or surgery. I think it's a very honest way. And physicians have to be ethical for our patients.
Absolutely. And I think too many times clinicians are worried that they're going to scare a patient off. If we are doing a facelift and laser resurfacing or a blepharoplasty with laser resurfacing to the face, and the patient says, oh, can I go out the next day? I say no. I say, why? What do you mean? I said, you are going to look like a burn victim tomorrow.
Right.
And they say, oh my gosh. I said, but in 2 weeks, you're going to look better than you've ever looked. You're going to have healthier skin, all these different things. So the goal is not for you to do this surgery and expect to go out tomorrow. Our goal is to have you looking great for the next 10 years. So give me a week of downtime to get you there. And it's the same thing with Belkyra. When they're like, how swollen could I be? I look them straight in the eye and I say, you could look like a bullfrog tomorrow.
Right.
But it's okay. That means the fat cells are dead, the body is healing, and you're going to get a nice outcome, but you have to give me some swelling. So if you have an important job interview this weekend, if you want to go to a wedding tomorrow, today is not the day to do Belkyra. And I think the transparency comes across and patients appreciate ethics and honesty from their clinicians.
Of course. And about the Belkyra treatment, do you have any suggestions for Taiwanese doctors in terms of like the Asian skin type or anything else?
Yeah, I mean, I think typically Asian skin type tends to have better quality. Dermis, not as much skin laxity. Most of the time Asian cultures historically are much better at taking care of their skin from the sun damage, and as opposed to a lot of the European cultures, or the Western cultures. So I think thinking about that means that often my Asian patients get a very good outcome because they have a good skin soft tissue envelope. They don't have a lot of laxity, they don't have a lot of platysmal bands, they don't have thin, crepey, sun-damaged skin because they're much better about taking care of their skin. So I think by default, after the Belkyra treatment, they get much better skin retraction because they don't have a lot of loss of elasticity and increased skin laxity. So I'm actually very encouraged by the Asian skin type. The only thing that I would say though is a lot of Asians tend to have, or at least it seems like, sort of a softer mandible. They are microgenic or retrognathic. So I think when we're addressing the lower third of the face, we must also understand that part of lower third facial rejuvenation includes chin and jawline fillers. And so my patients get a very comprehensive consultation that I'm going to get rid of the fat, I'm going to tighten the skin, but I may need to do some work on your jawline to get you that final nice aesthetic outcome.
In terms of Belkyra treatment, I think we are moving our aim to a very clear jawline. It's the trend of the aesthetic medicine. And do you do the filler injection at the same session with your Belkyra injection? Yeah.
So the answer to that is I do not. I think I prefer to wait till the Belkyra has done its work, so then I can look at a cleaner skin and soft tissue envelope without as much bulk, and then put the jawline filler or chin filler in. And as far as what you were saying about the new trend, I call it, or think of it as the chin is the new cheek.
Right.
So because we're creating new chin jawline definition, because we never had a tool to do that before. So I think the chin is truly the new cheek. We know how to create volume and give people nice cheekbones and structure there, and now we can start to really do that in the chin and jawline as well. Yeah.
Do you combine the skin tightening device at the same session with Belkyra, or as you say, you will postpone it after the Belkyra injection?
I like to postpone it. So what I want to do is get rid of the fat, see how much retraction the skin is having from Belkyra, and then decide on my next step, whether it's to create structure in the jawline to again give some more tightening here, because by filling the jawline like a chin implant or something, we were actually, you know, elongating or lengthening, which means we're tightening the skin also, so to speak, and then I can come back and treat skin quality with skin tightening type treatments.
Makes sense.
Yeah.
Do you have anything to explain to the Taiwanese audience about the Belkyra treatments?
I would say probably the biggest thing is the social downtime.
Right.
You know, you want to make sure that you do this at a time when it's convenient to have a little bit of swelling. Like Taipei or like, you know, many of the major cities around the world, including New York, there's never a good time for busy people to have social downtime.
Right.
But I think you have to wrap your head around that, let it be a non-issue, and just understand that you're getting a permanent improvement, and all you have to do is give some social swelling and social downtime. I think probably the other thing that's really exciting is that Allergan, which is the company that made it, that makes Botox, that makes our Juvederm, they are rapidly expanding the potential of this amazing drug. And we are helping them with new areas. So, you know, sneak peeks are the jowl, bra fat, abdomen. There's a lot of new areas and innovation that we are trying to proceed with and pursue to help take care of patients with small little pockets of fat and give people a new alternative to having surgery, which is really exciting.
Right. The off-label use of indications right now, like the joint, the bra fat you are mentioning right now, probably will become the on-label use in the future after the scientific work led by you and other staff in the world.
Yeah.
So exciting about that.
It is really exciting. You know, it's sort of like thinking about, you know, 20 or 30 years ago, if you told someone that we would take basically a metal tube or straw, stick it under your skin and suck out your fat, they used to be really scared of that or think that's science fiction, and now that's liposuction. It's the world's most commonly performed cosmetic surgery. And I think if you thought 10 years ago that you could take a safe FDA approved drug that is shown tremendous efficacy and safety, and it's in the palm of my hand and I can inject it and permanently destroy and melt fat, we'd say, wow, that's amazing. So the future is here, and now it's just us learning and expanding its growth and potential rapidly.
Right. I think it's something built on a very robust and solid knowledge and surgery training background like you. So I really appreciate your
well,
training.
we all help each other. You know, you've written chapters and textbooks on water-assisted liposuction, so you know we know that we all learn from each other as experts. And what you're learning from me right now will turn around in a year and be learning something from you because you'll have it in Taiwan first. So I think bringing like-minded professionals together who become colleagues and friends leads to all of us upping the game and being able to take care of our patients. So it's as much of an honor for me.
Thank you so much for the interview.
Absolutely. Thank you.
Thank you.